Welcome to the Outcomes Health Connections CCV Field Practitioners Training Program. This presentation will cover Course 2, Module 5, Diagnostic Testing Procedures. Today, I will demonstrate how to correctly use the Home Access Blood Sample Collection Kit, labeled as the Mail-in Lab Test. This kit is used for blood sample collection for patients having an order for serum lab tests. One kit can be used for any, or all, of the following blood tests: hemoglobin A1C and/or LDL-C. Our goal is to ensure that you understand the testing process and that the samples you submit to the laboratory are adequate for testing. Let's begin by discussing three important factors that can directly affect the success of sample collection and viability: patient hydration, sample amount, and heat exposure. The first factor is patient hydration. The patient must be well hydrated to ensure that an adequate blood sample is obtainable. While making the appointment reminder call to the patient, the HCC staff also reminds the patient to drink a full glass of water 30 minutes prior to the CCV appointment time. If the patient did not do so prior to your arrival, have them drink a full glass of water, then proceed through the visit. Then proceed to collect the blood sample after 30 minutes or more. This will give the body enough time to adequately absorb the fluid, and should increase blood flow. The second factor is sample amount. You must collect an adequate amount of blood for the sample to be completed by the lab. Inadequate samples will be rejected by the lab. The third factor is heat exposure. Exposure to extreme heat or direct sunlight, such as leaving the sample inside of a car in hot weather, can accelerate degradation of the sample. Once you address these three main points of concern, you've already significantly increased the odds of obtaining a good blood sample. Inform the patient of the lab test ordered. If the patient does not want to have the test done, document their refusal on the lab page of the CCV assessment tool. If the patient agrees to the test, and you are ready to collect the blood sample, open the test kit and review the contents. Each kit should contain the following items: instructions for use, 2 sterile safety lancets, 1 gauze pad, 1 bandage, 1 sample collection cassette, 1 sample pouch, 1 patient info card, and 1 return mailer envelope. Now open the bandage and gauze pad, and lay out the other components. As you do this, you may either ask the patient to fill out the patient information card, including the collection date, or you may fill out the card yourself. Inform the patient that the gray wallet card at the bottom of the label sheet is not valid for this project. The test results will be sent directly to their primary care provider. Confirm that the barcode on the patient info label matches the barcode on the sample collection cassette. This number will be used to link the specimen to the correct patient. Once the patient information label is filled out, and the barcodes are confirmed to match, peel the completed label off the card, and stick it on the outside of the sample pouch. Now you are ready to begin collecting the blood sample. Instruct the patient to wash their hands with very warm, soapy water. The soap helps to remove oils and lotions that may interfere with lab results, and the warm water increases blood flow to the hands. Once finished washing, have the patient shake their hands vigorously. This will get their heart pumping, and increase the blood flow to the fingers. If the patient is unable to wash their hands, use an alcohol pad to clean their finger. Be certain that the alcohol is completely dry before pricking their finger. Although you may have performed many finger sticks before, please note that this test requires more blood than the typical finger stick test. First, remove the clear plastic cap from one of the lancets provided. The second lancet is a backup just in case the first lancet doesn't work or becomes contaminated. Select the finger you intend to prick, preferably the pinky finger on the patient's non-dominant hand. If their hands are callous, do not stick the fleshy part of the fingertip. Instead, prick the middle or side of the fingertip. Place the lancet on the finger and press down firmly, holding for 1 second to ensure a good stick. Keep the patient's hand pointed down, below the heart. Gravity will force blood to the puncture site. Now, massage from the wrist to the puncture site to draw blood. Don't squeeze at the puncture site. This could cause the red blood cells to break. resulting in a hemolyzed sample which is untestable. Instead, start squeezing from the wrist, and move down, all the way to the puncture site. Place the blood drop in the collection well by lightly touching the drop to the paper inside, but be careful not to press hard on the paper. Between each drop of blood, wipe firmly with the gauze pad to remove the clot and reinvigorate the blood flow. Continue placing drops of blood until the collection well is full and the indicator arrow has turned red. Stop adding drops of blood when the indicator turns red, or the collection well looks like a pool of blood. Allow the sample cassette to air dry for at least 15 minutes before placing it inside the sample pouch. After a minimum of 15 minutes, place the sample collection cassette into the labeled specimen bag. Seal the bag securely. Do not remove the desiccant pack inside the sample pouch. This helps the sample to finish drying, and keeps it stable during the transit to the laboratory. Insert the sample pouch containing the sample cassette into the return mailer envelope. Seal the return mailer envelope securely. Place the sealed prepaid mailer inside any U.S. Postal Service mailbox the same day the sample is collected. The sample must be received by the lab within 7 days of the collection date, or it will be rejected by the lab. If the sample must be mailed before or during the weekend, be sure not to place in an outside mailbox risking heat exposure. Mail inside the post office in those instances. Inform the patient that their test results will be sent to their PCP. This process may take up to 2 weeks. The HCC will schedule their follow-up for review of the results. You must then document the date, barcode, and any other pertinent information regarding the blood sample collection on the CCV assessment tool. Congratulations! You have now completed the training session for blood sample collection. Please complete the quiz for this portion of the lab training. Thank you for your time and attention.